Hey, brothers and sisters, hope you're good. Today I wanted to share with you some new findings of a new study that has been conducted at Francis Crick Institute and Berlin University Hospital concerning COVID-19 and its severity. They found out that there were 27 protein markers. These protein markers were present in the blood plasma in different levels depending on the severity of the symptoms. So basically these proteins markers, they were an indication of the severity of the disease. The more protein markers you have, the more the severity of the disease is present, and less markers, the milder the symptoms. Francis Crick basically developed this technology, and they use mass spectrometry to which is basically a technology to separate atoms and even molecular fragments. Very accurate technology, very reliable. So what happened that they used this technology in Berlin, at Berlin University Hospital, and they tested the serum of 31 I think patients, and they found out these markers, these protein markers. Three particular markers, they were associated with the protein interleukin, and we know that interleukin protein is responsible for inflammation, and also very vital for the regulation of the immune system. So the inflammation that we have when we have any kind of infection, interleukin is directly responsible for that. Another indication of the markers that they found is the severity of the disease depends on the many factors, as we know. But for this, as a result of this study, so the doctors could use this as a tool to predict the patient's situation, and to predict and to prepare a proper treatment for these patients. So what needed now is to find a test, and very simple test, to find these markers in patients, COVID-19 patients. And in accordance with the tests and the results of these tests, the doctors and the clinicians can prepare the patients for either if they're gonna have severe symptoms, or if it's gonna be mild, or need hospitalization, or if there is no need for hospitalization, and so on. So basically this is a very important findings. The other thing is they could use this technology as well for different diseases and different conditions. So we know very well that most people develop very mild symptoms when they infected by coronavirus, but this technology will give the doctors the opportunity to prepare and predict the severity of the symptoms for patients. So therefore, is a very useful technology. The other thing that I want to talk to you about is of course, it was very fortunate today that we have the global vaccine conference or summit rather, and they managed to raise about £7 billion, which is rather good actually. They exceeded their expectations. Of course, this money will be used for different vaccines like measles and different conditions, polio and so on. And that they said in the summit that it could save 8 million lives and so on. Very good news. And it's as well the part of it to the effort to finding the vaccine for the coronavirus for COVID-19. Recently, there was another study at Hartford University, and they were saying that the virus can only be destroyed at very high temperatures, and they were suggesting like 56 Celsius or something. That's rather bad news. One of the other findings was a study conducted, I think, was about anyway, they found it that copper was absolutely brilliant with the COVID-19 as a service, so we could use it indoor handles or services in workplaces and schools and so on, because the virus cannot survive more than 2 to 4 hours, while it could survive in a plastic surface or steel for about 72 hours. So because copper, the electromagnetic atmosphere attack the membrane of the virus, and then the copper attacks the virus itself and destroy it, which is very, very, very impressive actually. We hope that we're gonna have some good news about the vaccine or development of a new treatment soon, and we'll meet soon inshallah.